This is Pavas Mehra. We are at Pareto Securities annual healthcare conference, and with me today I have Chairman of Mentice, Lawrence Howell. Welcome.
Thank you for having me.
Please tell us a little bit more about your company and the product.
Mentice is the world's leading provider of endovascular simulation hardware and software. We work with all of the world's major medical device manufacturers and helping them demonstrate their new devices and helping them train doctors from hospitals in using the devices. We also work with about 400 hospitals so far in helping them train doctors in the general practice of endovascular surgery, as well as advancing their skills with regard to specific devices. So that's a global business of ours. We have about 100 people involved in developing the hardware and software, a sales organization and a support organization divided between Göteborg, Denver, Chicago, Beijing, Tokyo, and we have some offices in Europe as well.
Yeah. And you were listed on Stockholm First North earlier this summer, and the stock price reaction has been great since then, but for the investors looking forward, what should they focus on? Are there any key events that they should be on the lookout for?
Well, it's always helpful if our revenues and our business grow as it's been growing in the past. We anticipate that'll be the case. The primary drivers for that going forward, I think, will be 3 or 4 different things. Number one, we are advancing our ability to convert our business from being just a training business to a business that is actively involved in the actual surgical procedures. So we today have the capability to provide surgeons an image of the patient that they are going to operate on either immediately or tomorrow and do what is called mission rehearsal. With those doctors, with a whole team around a table, a cath lab, which is normally the facility used to perform the surgery, so they can operate in effect on the patient in a virtual environment immediately before performing the surgery. So that's a big step for us, stepping out of the pure training environment. Enhancing that is the fact that we've got a joint venture, distribution arrangement with Siemens and Philips, who sell about half of the world's cath labs every year, nearly a couple of thousand. And we have interfaced our equipment with them so that every doctor and every hospital that has a cath lab in their surgical rooms are actually able to use our facilities to practice on their machines, using our interfaced equipment to do simulation on actual patient cases or on test patient cases. So that's a major development. We have 2 other initiatives that we think are quite exciting. One is we are in a position to convert some of the inputs that we make in simulation, which we measure. We measure speed, rotation, force for every surgical practice that people do, and that's input that we can provide to robotic procedures going forward at a distance to sort of provide input as, let's say, mentors to the robots. And finally, we're in a position, because we need to expedite the rate of transition of data from machines like X-rays and from MRIs to information that is usable in a surgical environment. We are converting that data into 3D digital images, which can be used in simulation, and we've made some major progress where we can convert the images sometimes in a matter of seconds to data that can be used live, and people could actually during the surgery use our live data in order to simulate difficult parts of the surgery. So that's exciting for us as well.
Yeah, that really sounds exciting. Thank you for being here today, Mr. Lawrence Howell, and we're looking forward to following Mentice going forward as well. Thank you.
Thank you.